All right, shall we start? I think so. Well, hello, everybody. My name is John Wilkes. I have the privilege of being the Chief Executive of the Institute of Health and Social Care Management. And today, we're not only looking at well-being, but we're looking at the quantified effects of well-being. We're going to be covering a number of topics, including how authorities define well-being, how they measure well-being, and we're going to look at different ideas in that regard. And then we're going to look at some of the research that exists around the consequence or not of well-being or non-well-being. I hope this is helpful, and we'll end up with a quick Q&A, I think. Okay, so what I'm going to do now is share my screen, if I may. You should all be able to see that wonderfully well now. Okay, so well-being, here we go. I wanted to start off by just talking to you about subjective well-being, what it is and what it isn't. And this is really governed by a research paper conducted by a number of people, but not least Gus O'Donnell, who was a very senior civil servant in various government departments. And this was the O'Donnell et al. 2014 survey into well-being and public policy, which was basically the government's efforts and civil servants' efforts to define what is well-being and whether the measures that government and other organizations use to define and measure well-being is indeed appropriate. And one of the central things they looked at is what is the role of government? And they deduced from their well-being and policy document, you can see if you're interested in tracking that down. I have put a link in the slides that I'll make available afterwards. You can see there's the document, but they reached the conclusion that the role of government is to maximize the sum of citizens' happiness, which I thought was rather splendid. Just hold that in your mind for a few minutes, okay? The big question that we've got when we're looking at subjective well-being are these three questions. So number one, how do we compare my well-being with that of somebody else, be that Sue or John or Binny or Jayati? How do I measure my well-being and the things that are important to me, for example, versus maybe what's important to each of you? And how do we encompass the differences in perception or priority that any of us may have? Going along from there, how do we compare my well-being now with what I might want my well-being to be in the next year, for example? But finally, most importantly of all, and this is from the O'Donnell report again, government tends to look at cost-benefit analysis when it is considering policies. And indeed, the organization that you work for, whether that's in health or social care, you can be certain that before they do anything in respect of investment or allocation of time or resources, they will conduct typically a cost-benefit analysis. The big question is, if it's, say, the impact of a taxation or a benefit change, policy analysts tend to list the results by income group. And is that fair? So do I link my well-being as look, I'm in a nice position. I don't have particularly any money worries. I'm healthy. I'm sort of soundly middle class, I would guess. Is it appropriate for me to have my well-being measured in the same classification as somebody who, for example, is homeless or is struggling with a health inequality or is struggling with financial inequality or something of that nature? So it's this balancing act that we have to do when we're considering this business of subjective well-being. These are the means by which typically well-being is measured by a state or by governments or by state-run organizations like the health service. So number one, they would look at, traditionally, the big indicator for government has been gross domestic product, the extent to which we are capable of turning our resources into financial outcomes. Moving along from there, then, they might look at other economic measures like social capital, environmental sustainability, or financial inequality or equality. Moving on from there, you might look at education, health, inclusion, or pollution. But the bit where most of us spend our time when we're talking about well-being is in subjective well-being. That is to do with happiness and life satisfaction. The big question moving on from that, of course, is, well, are we all measuring it the same way? So this is again from the O'Donnell report, where they conclude conventional cost-benefit analysis using market or shadow prices is familiar and long used, but its familiarity should not disguise its problems or the enormously important issues that it does not take into account. Life evaluation measures, although less familiar and more recently used, have problems of their own, but can provide a method for policy evaluation that holds out hope of giving answers that are more relevant to what is really important in people's lives. And when we're evaluating well-being in our organization, big or small, I think this is a really important aspect to consider, because looking at another report from Bryson, Forth and Stokes, or indeed the OECD directive for how we should measure well-being in people, the OECD arrive at all of the various evaluations, positive and negative, that people make of their lives and the affective reactions of people to their experiences. That's how the OECD say we should measure well-being. And what I've done is highlight again, I've provided you with a hyperlink to the Department for Business Innovation and Skills most recent report into this, 2014, which was on the subject of, does worker well-being affect workplace performance? Now there's the cruncher. So what we're going to do is look at that particular aspect in all that we now do. I don't know whether any of you have come across this chart, but if you're interested in well-being, or if you're responsible for an HR or OD element within your organization, may I suggest you cut it out and then staple it to your forehead so that you're able to read this with absolute regularity. These are the factors affecting subjective well-being at work. So you can see on the left-hand side over here, all the things that you might think have got nothing to do with the workplace, but guess what? People bring these things to their workplace, whether they mean to or not. So this would be to do with family and social circumstances, but then in terms of the person, it's to do with their genes, personality, age, gender, values, and preferences. And they, funnily enough, are different for all of us. No one of us is alike. So why should we necessarily try to measure well-being on the assumption that everybody has the same priorities for what well-being contains? If I go over to the right-hand side then, this is all the specific workplace stuff that people would regard as important to their well-being. You can see here, one of the central things, co-workers and the extent to which they get on with them, HR practices, the actual workplace environment itself, and more on that in a moment or two. But then in terms of the job, the demands of the job, the control I have, the role clarity, sense of security, pay and equity. And then both of these two elements contribute to this business of subjective well-being, which is to do with the effect of these things, job satisfaction, and a fantastic word that I came across in preparing for this, which is eudaimonia. Had any of the rest of you come across eudaimonia? This is from Aristotle, where Aristotle described eudaimonia as the business of humans flourishing and the highest human good. I like this human flourishing bit. I think that's a great way of trying to describe well-being to an individual. What does it really mean? Okay. If we understand all of this, well, here we go. This is the WERS, the Workplace Employment Relations Study of 2011. And they said there are 4 workplace well-being measures to do with performance now. So they're looking at financial performance, yeah, fine. Labor productivity, that's to do with the output that we produce. The quality of that output or service relative to the industry average. And then the workplace performance additive scale constructed from those 3 measures above to assess overall workplace performance. Why is this important? Because of this. Now, I'm just going to warn you, there is some sobering reading to do here. But if the situation is, as it says here, this is from various different studies, we need to be really conscious of the fact 1 in 4 of employees in the United Kingdom have less than 1 month's financial savings. I'm going to repeat that because I was shocked when I read it. 1 in 4 of our employees have less than 1 month's savings. Post-COVID, 44% of employees say they don't feel secure in their jobs. And 50% of HR professionals in a CIPD study conducted in 2019-20 admit that they've not created or implemented a well-being plan for their organisation. Moreover, 67% of our employees say they are sometimes, very often, or always burned out at work, and that means they are more than 63% likely to take a sick day, and they are 2.6 times more likely than others to leave their current employer. Now, before we get to the other stuff, just read those 4 first points again and ask yourself, are we setting ourselves up as a nation to fail on well-being before we even start to do some of the things that we as leaders might choose to do with our teams? Are we already set up to fail given the background there? And then go into, look, fewer than 3 in 10 employees, less than 30% of employees in the US, UK, Spain, France and Germany strongly agree that their performance is managed in a way that motivates them to do outstanding work. Wow. Wow. In other words, more than 7 out of 10, more than 70% of our staff, of our workforce here in the United Kingdom, feel that actually their performance is not managed in a way that motivates them to do outstanding work. That's before you get to those other 4 points preceding it. Gosh. And then we get to, here we go, you ready? Some good news. 75% of our staff believe that senior leaders have employee well-being on their agenda. That is up from 61% last year, so a 14% improvement. And 2/3, 67%, report that line managers are bought into the importance of well-being, up from 58% last year, so a 9% improvement. But before we all get carried away, just go back over to this. 70% plus of our employees do not feel that the way they are performance managed motivates them to do outstanding work. So imagine now that you are one of the people with less than 1 month's savings. Imagine that you're one of the 44%, nearly 1 in 2 employees who don't feel secure in their jobs, and you are being performance managed in a way that doesn't motivate you to feel that you can bring your very best to work on a daily basis. Wow. Wow. And still, for some inexplicable reason, we've got 50% of HR people across the study. This is not just health and social care, I stress, but 50% of HR professionals have not created and implemented a well-being plan. Wow. What I thought might be interesting to look at then is this chart here. So this is from the CIPD survey of 2019. As a result of the COVID-19 lockdown, are the following better or worse off? Physical health, 40% say worse off. Mental health, 45% say worse off. Financial security, 36% say worse off. Social connections at work, such an important part of boosting our employee, our well-being, 42% worse off. This is shocking stuff. This is the effect of COVID, basically, on these important aspects of physical, mental, financial, and social connection through work that anybody with half a brain would know are really important aspects for our individual well-being. So the sit rep is not good, folks, is it? Let me lead on from here and try to get a little bit more positive, if I may. There is some good stuff being done. What I've done here, I do hope you're able to read this and you're not trying to look at this on a telephone or something like that. But these are some of the stuffs that HR departments or large organizations are providing for their employees. So in terms of health promotion, 67% for all employees provide free eye tests, 49% free flu vaccine, 47% advice on healthy eating and lifestyle, 37% of large organizations provide an in-house gym or subsidized gym membership, 33% provide programs to encourage physical fitness, 30% do well-being days. These are days devoted to promoting health and well-being services to staff, 28% health screening, 24% regular on-site relaxation or exercise classes, yoga, reflexology, massage, etc. And then in terms of direct employee support, this is good news, I think. 74% of organizations who responded to the CIPD survey said that they provide access to counselling services for staff. 74% also say that they provide an employee assistance program if people are struggling with their well-being. 35% provide financial education and support, 32% access to physiotherapy and other therapies, and 27% to smoking cessation programs. And then in terms of insurance and protection initiatives, 23% health cash plans, 21% private medical, 21% dental, 17% long-term disability and permanent health insurance, etc., etc. So what I took from that is, do you know what? A lot of organizations, probably yours as well, are actually working to provide stuff that 10 years ago they wouldn't have dreamt of doing, or would be far less prevalent than is the case now. And I think that's commendable. The big question to ask is, if your organization isn't doing that stuff, then I think you've every right to write into your HR people and say, do you know what? CIPD report 2019-20, if you want to look at it, it's figure 6 in there. And yes, I have provided you with a link to it on one of the previous slides. Look at all the stuff that organizations are doing that is in direct correlation to a desire to improve employee well-being. Now, moving on from there, I just want to show you the next thing. These are the most common causes of stress at work according to the CIPD. So 59%, or I think this is a scale actually. So 59 on the scale is to do with workload or volume of work. 32 is to do with management style. Just hang on to that for a moment or two. 31, new work-related demands or challenges due to home working as a result of COVID-19. And I ask you to correlate that with one of the earlier slides talking about problems with lack of societal contact and such like, and financial pressures. 25 is non-work factors, relationships, families. In other words, stuff that they just bring to work with them because they can't get it out of their mind. 23 is COVID-related anxiety, fear of contagion. 22 work factors, non-work factors. 20 poor work-life balance, and 20 actually relationships at work. Now look, I think this is pretty straightforward. I think that the natural consequence of this is that, do you know what? We ought to be crawling naked over broken glass in our determination to make sure, A, we understand the workload and volume of work that we're asking our workforce to undertake, and we need to be asking ourselves with them, is that sustainable? Because look, 59, that's the most common cause of stress at work. 32, management style. Correlate that with the 70% of people who don't feel that the way they are performance managed in their workplace stands alongside their willingness to come and give of their very best. I think we have a massive problem, in other words, with performance management and management style in too many of our organizations. I'm not even going to go there whether it applies to your organization. Odds on somebody somewhere is not doing it at all well. And then the quantified effects of this. Well, this is real deep intake of breath stuff. 32.5 million days lost to workplace ill health 2019-20. Can you imagine the total cost of that if you were to average out the cost of an individual day? Wait for it though, nearly, well, over half of that, 18 million of those days is due to stress, anxiety, or depression. And you know from the previous slide, most of that is being generated by workload or volume of work and or the way that people are being managed or performance managed. I find that really sobering, really sobering. And if you're still unsure about the quantified effect of this, you can click on that study which I've underlined there, Employee Wellbeing, Productivity and Firm Performance. This looked at nearly 1.9 million employees, over 82,000 business units across 49 different industries worldwide, and it absolutely correlated that higher well-being at work is positively correlated with more business unit level profitability. And then what I've done is included a figure from that report. COOP is an award system for organizations, typically large organizations, and particularly in the United States, who demonstrate a commitment to staff well-being. And you can see their cumulative stock performance in percent of COOP award winners compared with the Standard & Poor's 500 index in the United States between 2001 and 2014. Look at the number. It's inescapable, in other words. If you're still wondering, I've got a little piece of paper here. You ready? This is to do with engagement, the extent to which employees in an organization, if they are engaged, actually the effect that that has on performance. And PS, engagement falls off a cliff if people don't feel well. Levels of engagement matter because employee engagement correlates with performance. This is at the heart of any argument why employee engagement matters in the UK. Gallup in 2006 examined 24,000 business units and compared top quartile and bottom quartile financial performance with the engagement scores in those organizations. Those with engagement scores in the bottom quartile, so the organizations, the business units that were in the bottom quartile were the worst performers in terms of employee engagement, averaged 41% more employee turnover, 51% more inventory shrinkage, otherwise known as theft, and 62% more accidents. Those with engagement scores in the top quartile averaged 12% higher customer advocacy, 18% higher productivity, and 12% higher profitability. What do you all deduce from that? It's inescapable in my mind. Workforce well-being directly correlates with productivity, prosperity, and profitability in firms. It directly corresponds with safety at work, with well-being at work, and with the whole business of people feeling engaged with what they do. And I just think that ultimately, if we're serious about doing what we do in respect of well-being, feel free to use some of these stats. But I go back to the analogy, we should be prepared to crawl naked over broken glass in pursuit of any improvement that we can reasonably achieve in respect of employee well-being. All right, I think that's that. So I'm going to stop sharing and I'm going to open this out to all of you. I've tried to lay the ground, basically. I've tried to prepare the ground. I've tried to show you some of the research that exists. I've tried to show you some of the outcome measures, the quantified effects basically of well-being from a variety of different studies that have taken place. What do you all make of it all? Are you even more anxious to promote well-being than you were half an hour ago? Or is it kind of, well, yeah, I knew that was the case anyway, John, I'm just here because I like the sound of your voice? What would it be? Would anybody like to comment? Sue, come on, you were here right at the beginning. What do you make of all of that?
Well, I mean, this is my bread and butter, John, to be honest. And so I think the one thing that perhaps we didn't draw out from that, the impact in the NHS, is that there's been quite a lot of studies done, usually by Michael West, about the impact of staff poor well-being on patient care. Yeah. And when staff are asked if they believe their own well-being has a direct impact on their ability for patient care, over 50% of them said it does. So it's more than a monetary value in the NHS, which, you know, it's easier to quantify that than it is to quantify the impact of staff poor well-being in the NHS, because it has a direct impact on patient care. So there's even more of an imperative to crawl over that broken glass, because it has a direct impact on our ability to look after patients. And so one of the, if
I may, Sue, just
yes.
to take that argument further, which is a perfectly sensible thing you've said. Let's remember that 32.5 million lost days.
Absolutely.
To do with workplace stress. Put that alongside 150,000 vacancies within social care, something like, we think still, I think 60,000 vacancies within healthcare, and just ask yourself, if we got our well-being right and we at least reduce, let's not even be bold, let's say, could we reduce that by 10%, that 32.5 million lost days? What kind of an impact would that have for the extent to which we're able to look after our patients and other service receivers? But yeah. Sorry, I interrupted you. You were about
absolutely.
To tell us.
Yeah, so I'll send you an electronic copy of this, John. So this is a piece of work that myself and Mike Farah and Sir David Nicholson done around in 2010. And within this, these are NHS organisations who developed and delivered wellbeing programs. They monitored them, they measured them, and they got all the impact and about cost savings as well as performance. I'll send you an electronic version of it, John, because it's quite interesting, and it was done in response to the Steve Borman review from 2009, yes. who told us very much the same sorts of things that you've outlined as well, and actually not much has changed. So it's not for the want of research, of data, it's actually the commitment and the willingness to change culture. So I think we look at the other end of it and say, okay, so we'll have a health and wellbeing day, we'll do this and we'll do that. But if we don't change the culture, actually nothing else changes. They become initiatives.
Yeah.
So
I think something that we might like to lead on, through perhaps even through our workforce group, special interest group here, is to do a study of NHS and social care organisations to find out some of the basic stuff. You know, I gave you the list of things that are being done that are kind of positive for well-being. I just wonder, you know, from 2010 to 2022 now, what's changed? How many NHS and social care organisations are providing good quality financial advice to people? How many NHS organisations are properly evaluating the way that they're performance managing people?
Yeah.
How many NHS and social care are properly evaluating the extent to which we are measuring absenteeism and correlating it with issues to do with stress, anxiety and depression? Now, these are all things that we know from all the research that we've done are important to people feeling well at work. But I have this horrible feeling at the back of my mind here. Do you know what? We're still not universally taking it as seriously as we ought. And we'll continue to moan about unauthorized absence and that kind of stuff, or unplanned absence and vacancy rates and so on. But do you know what? A lot of this is within our control to do something about.
It absolutely is.
If we took well-being seriously.
Yeah, it absolutely is, John. It is within our gift to make a difference. You need the commitment and the will. One of the things that we evaluated about why did these things work? Why did we get the outputs and the outcomes that we did on this program? And it was about senior leadership. Without doubt, every single case study that we done, every one of them said that the commitment of senior leadership to lead by example actually was what made it work. There was lots of frontline workers who would get their hands dirty, they would do all kinds of stuff, but without the commitment at the top, without that level of commitment to well-being, they actually fizzled out and failed. Yeah. So it's a top and a bottom, isn't it? That, you know, you can grow it from the ground up, but you need the culture at the top to enable that to flourish.
Well, I've got to say, my real worry, Sue, and we'll let other people come in a minute or two.
Yeah, sorry.
No, not at all. No. The real thing that made me suck in my breath and sort of slap my forehead and say, we cannot be serious here, is that revelation that 70% plus of our workforce do not feel that they're performance managed in a way that makes them want to come to work and give of their very best. And I just find that a horrible statistic. And I worry that we're trying to performance manage the wrong things.
Yes.
We're trying to performance manage stuff like preparation for a CQC inspection. We're trying to performance manage stuff like reducing wait lists. We're trying to put pressure on people, in other words, to address targets that, do you know what? That's not why they came into the NHS or social care, be that clinical or operational. They came in for all sorts of other vocational reasons that have got nothing to do with these other targets that may well be important to certain people, but that's not what's going to help people to feel that their own performance is being managed effectively. All right, would anybody else like to, thank you so much, Sue, that's a great first contribution. Would anybody else like to offer some opinions or analysis or whatever else? Do just pop your hand up. Vinny, lovely to have you along again.
It's always me. So I'm back to this question of, if you have the commitment from the top, you're willing to do this, how do we track our progress? How do we say what we asked at the beginning from an individual perspective? How is my well-being better this year to last year? But also from an organizational perspective, how can we, from senior management, or from, I'm not senior management, but you know what I mean, from management, from the exec team, how can we know what we are doing is working and it's having an impact? And how do we quantify the impact that we are having, essentially the evidence? How do we evidence what we're doing?
Well, shall I offer my own view first of all, and then I'd be delighted to open this out to other people in the audience. Personally speaking, I'd go back to some of those characteristics that we spoke about during the earlier presentation. So ask people, do you feel that you're being performance managed in a manner that makes you want to bounce into work like Tigger on speed? That's the first. I probably wouldn't phrase it in those terms, but you get the gist here. The second thing I'd ask is, do you feel that you have the opportunity to discuss your personal finances in a supportive and positive manner within the workplace? The next thing I might ask is, do you feel well? And ask people to just comment on that. So I'd keep it pretty simple, and I'd do it very regularly. I wouldn't do it annually. I'd do it far more regularly than that, so that you can actually measure the impact of any straightforward practical things that you can do in the organization. That's where I would start, Billy. But do you have a view, first of all?
I would try and do it in a way that we're not, so given we're talking about the overworked staff, engagement is important. I wouldn't dispute that, but what I would say is, I would know if I was a nurse on the ground in a GP surgery, I'm not sure I want to be filling out these surveys every quarter or whatever. Does that make sense? So whilst there is an engagement, or there may be an engagement, there is also, active engagement versus passive engagement. And I think a lot of staff probably wouldn't want as much active engagement just because they have other things to do.
Do you know what? I might make it as easy as at the end of every day, we just ask people to hit one of those, you know, the consoles you get in airport checkouts?
Yeah.
Got, you know, it's a red, amber, green. And the only question on it is, have you felt happy today? And we ask staff to just whack one of those 3 buttons. And you just, therefore you get an outcome every day. That's it.
Fair enough. Yeah.
Maybe it's as straightforward as that. And you know what? From there, you can then figure out if you're able to identify cohorts where actually it's not so good, or it's actually been improving massively, then you go and find out why. Straightforward as that. Maybe we you know, we're always great at overcomplicating stuff, aren't we? But maybe just the simplicity of asking people that straightforward question.
Fair enough.
Just a thought. Anybody else got any view on this? It's a great question from Binny. How do we measure well-being in our workplace?
So can I say, John?
Hello, Jayoti. Of course you can.
I think it's more about recognition and motivation. Like I know someone who had CQC. Their organization would have failed. The managers were away on their holiday at that point. This person went out of her way, connected with senior managers to turn the whole outcome to good from a failing one. And when the manager comes back, this was more about them feeling, hey, she did it when I should have done it, sort of a thing. And they started picking on her things where she might have missed on 1 or 2 things. And this person then was feeling, hey, I'm at a point where they might discipline me or whatever, in spite of slogging for a week to turn the outcome round. So it's all about motivation. She's now gone.
So how would we, if we're in an organization, health or social care then, Jayoti, how would we measure the extent to which our staff feel highly motivated?
Yeah, this person's now gone on a secondment because she was very unhappy with
But how would we measure?
I think the senior managers knew what was going on. When the manager came back and started picking on her, that shouldn't be that. When they knew, they shouldn't have turned a blind eye to it. That's what's happening.
I absolutely get that. Thank you, Jayoti. So
to measure this is hard because this is not documented anywhere.
Well, I understand that. I'm just talking in a typical health or social care environment. How might we measure this business of subjective well-being amongst our staff? Or, you know, you might be right. Maybe this is to do with the extent to which our workforce feels motivated, and maybe that's a good measure as well. But how do we do it so that, you know, going back to that piece at the beginning, remember?
Yes, I do like your idea of green, yellow, red.
Thank you. Where were we?
The specific instances.
There we go. That was it. This is what I wanted to just share with you. Forgive me. I'm just going to bring this one up again and then share it with you. There you go. That's the bit that I think is really interesting. And what that says is we're all different. We all have different priorities in terms of what we regard as important for our well-being. So the question is, how do you therefore measure well-being across a very diverse workforce who've got all sorts of different priorities? And perhaps we just try to, you know, just to revisit this idea, keep it simple. Just ask people to say whether they feel happy at work in their environment. That's the bit that I think is important. We've just got a couple of things in the chat. The Pulse survey, Philippe says, is kind of made for this sort of measuring too. On wards at Last Trust, you picked a token up: red for bad day, green for good. I like that. Mood tracking. Miss Whittaker says, hi, here at LSCFT Trust, we record a number rating in PDR to rate our well-being and have well-being only PDR goal. In our one-to-one, I structure around well-being. Okay, and I think I kind of understand that. So you record a number rating in your personal development record.
That's right, yeah.
Perfect. Okay, thank you very much. Does it work? Do people respond well to that?
The trust have only started it this year in response to the very question you're asking about how you, and it is only once a year, but at least it's a start and it's a conversation around your own well-being rather than, like you say, performance.
Yeah, and the only problem I have with a once a year thing is you could pick me now in May 2022. If you compared me to May 2020 or May 2021, you get a completely different result. It's got nothing to do with anybody other than me and how I'm currently feeling, to do with all sorts of characteristics and things going on in my life. And that's the tricky bit. It's then pinning it down so you can say, well, what's causing it?
Yeah, I know, but I think if you set a goal, because you'll have known that person over the past 12 months, hopefully, won't you? If you can set a goal related to improving their overall well-being with them, then you'd hope that you check in with that over the forthcoming 12 months.
I like it.
I just think it's good to have a goal for well-being, not just performance.
Absolutely. Absolutely. And I do like the fact that your trust has at least started to try to measure it. That's great. Let's get Binny, have you still got your hand up? Were you wanting to offer something, or is that a legacy one?
It's a legacy one. Sorry.
That's all right. Don't worry. Marlene then. Hello.
Hello. Hi. Sorry. I'm just interested. I understand I can measure it and I do different things to try and measure it. But what's really difficult, I work for a really small organisation in social care, but what I find really difficult is then putting things in place that do improve people's well-being and getting that right for people. So when you looked at that chart that you showed us, where we know everybody's different and everybody's well-being feels different, and what would work for one doesn't necessarily work for the other. So it's more, for me, what I find really difficult is getting it right. And when I get it wrong, so for instance, like you said, you were shocked by the idea that people don't have a month's worth of savings in their bank account, and you found that quite difficult. And so it's quite hard to work out what would have the most impact on the most people. That's what I'm trying to find all the time. I'm trying to find out what would help most people most of the time, or hit the mark, because I'm white, probably middle class British, don't necessarily get that right all the time, and in the past when I've tried to, sometimes I've been knocked for getting it wrong. So it's that bit that's difficult sometimes.
I think there should be an anonymity involved, which is what I think very difficult in a small organization. So I think when I was asking about measuring, quantifying, I think each measure you put in place, you do want to measure the effectiveness, and I think that's one challenge. It is easier in a bigger organization where you can have anonymous responses. I think in a small organization, you're not going to get people to admit to some of these things because that's their personal information, that's their personal life. So yes, I can see why that would be a challenge in a small organization. Like even someone like me who isn't white and female, you can, if someone asks me, am I uncomfortable due to my race? I'm not. If someone asks me in person, or it was obvious it was me, I'm the only non-white person in the room, I'm not really going to answer that question, am I? So you can't, unless you have the ability to have staff be honest, you're not necessarily going to get the information that you want.
So so here's the big question. Why would staff be honest with you? So let's address Marlene's point. She's doing her best. She's clearly committed to trying to do the best for the people within the organization that she leads rather. How can she be seen as honest? I think the T word comes into this, Marlene. I think this is to do with boosting trust. And so long as you keep honestly and openly, informally, doing one-to-ones with members of your team to ask them about their well-being and about their personal and work lives and so on, then I think people will, over time, they'll trust you. And so long as you then honor any commitments that you make to try to do stuff, I think over time you develop this virtuous
the thing is, like
improvement.
for me, the like for a long time during the pandemic, I really promoted like the wellbeing hubs for social care and people being able to access counselling and all those things. But actually, in practice, when you realise how long it takes from the initial assessment, the referral period. So like I've got team members and myself included that have waited like 18, 19 months for counselling. And so I know that's a postcode lottery. I know not the whole country's like that. But, you know, for people that I've like actively promoted and said, look, you can, this is free counselling, you can have 8 sessions, you know, it's perfectly, you know, confidential, use this. And then they come back to me and go, okay, well, that actually, you know, I'm still waiting and it's 18 or 9. Then you feel like you've really let people down because of that. So I think I probably have lost people's trust somewhere along the line in regards to some of the outside services that I've promoted in-house haven't always been available.
I do think you shouldn't beat yourself up, Marlene. I think you've been trying your absolute best, and this is not the first time you've come on one of our events. You know, you clearly enjoy and find support from the Institute's activities. A, don't beat yourself up. B, there's all sorts of other stuff that you can do to still improve that agenda. You know, John Glynn, who's on the call today, is a huge advocate of walking therapy. You know, just going for informal walks with people, even one-to-one or whatever, and just chatting. You're not even trying to drive an agenda. You're just having a chat. And I think if you just continue to try to do what you're doing, the small stuff is the big stuff. And I think over time, people absolutely will appreciate the effort that you're going to. But you know, please, you know, from everything I've seen and heard from you over the last few months during the pandemic and everything, I know the kind of caliber of person you are, and I know how hard you've been trying to motivate and lead your employees sensitively and empathetically, and full credit to you. Sue, you got your hand up, yes.
Yeah, no, there was 2 things really. Marlene, I'd be really happy to have a chat with you outside of this call, and if I can be of any help to you, then I'm more than happy to do that. So I do a lot of this work with big organisations and very small ones as well. So I'm more than happy. My email address is in there, so I'm happy to pick that up that with you. I guess one of the other thing I was wanting to point out as well is, John, when you made a point before about the list of all the things that organisations offer. So for me, it's what they provide, but actually what is the use? So are people using them? So it's very easy for organisations to say, well, we do this, 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 and this. And my response back to those organisations is, okay, so how many staff use them?
Yeah,
how do you know that was what they want? I
think that's a really fair point. I mean, yeah. I'm just an advocate of, you know, informal one-to-one feedback sessions and letting people talk.
So it's not a criticism of that. It's just really that it's quite easy for organisations to say we do this, but their staff don't use them, so it's their fault. We provide it, but they don't use it. But if it's not really what staff want, then actually they're not going to use it.
That's the key to the informal feedback session.
Absolutely,
is to ask people what they want.
Yeah,
to make them feel well and to make them feel motivated and happy. And Chris comes in, he says, the single biggest impact will be better pay in both NHS and social care. Sadly, a lot of other wellbeing improvements feel like wallpapering of some massive cracks a lot of the time. Well, Chris, I think pay is important, but actually a lot of the research says that there's other reasons as well that can make people feel motivated and so on. I'm not knocking what you've suggested. I think it's a fair challenge. But there's a lot of other stuff to do with personal well-being as well, I think. All right, look, we've got about 9 minutes left. Who would like to chat about anything else? Philippe says, Marlene, big win for us. It was really easy. It was a recurring fresh fruit delivery for the staff kitchen at one of our practices. Such a big difference from such a small thing. I like that, Philippe. As long as, of course, everybody likes a banana and a pineapple and orange. You know, the fruit dodgers, there we are. And there are some of those around, but, you know, just throwing it out there. Anybody else like to make any comment? John Glynn, yes, hello, John.
Hello, everybody. I'd just like to say that I think this is probably one of the most relevant. Now, I'm speaking as chair of the retired members group, everybody, and having seen it and been there. And I really think today's discussion, yours about John, mainly on staff flourishing, and Sue's comment about how that helps patients, I think is probably one of the most relevant presentations I've heard for a long time, and accurate in any way. And from just on my thing, the retired members person, just remember when you're coming up to retirement or leaving, all this wellbeing stuff, remember how you've been you've been trusted and liked and everything in your own job, and you suddenly come to not being in that position, how you've got to reinvent yourself and look back and see all the things such as we've talked about today. So I've probably not worded that quite as intended, but you get me drift. I thought really the presentation initially was good, and I thought Sue's comments about how that helps patients is particularly important as well.
Thank you, John. Great feedback. We appreciate that. You've got a fan in Jyoti as well who says, very true, John. There you go.
Yes, because I experience similar things as John. You feel, yeah. But another thing, maybe it may not be directly relevant for today, John. But one thing I see in health and social care organizations, once people cross the 55, their value goes down big way. And they are not kind of anything to get rid of them attitude comes in, and you can feel that in a subtle way.
Well, I mean, I know some of you will find this astonishing and probably untrue, but I am over 55, and I think this is about self-worth, and you know, having people around you who can contribute to that and help you if you are doubting yourself. And it's about demonstrating your value and being proud to do that. I think that's at the root of that. But it's an interesting observation, Jyoti. Thank you.
But you enter this kind of battle of trying to prove yourself all the time when you know you're good.
Thank you, Jyoti. I don't know whether you say that about me or yourself or
No,
let's not go there.
It's all in general. It's something worth discussing in future.
There we go.
What can we do?
That's all right. Philippe says he's trying to do a system-wide project with our region on addressing one big area of health and social care, with the point being that we release time and funding to be able to be more caring, i.e. reinvesting back into staff well-being in a real way. I like that, Philippe. That sounds interesting. Anybody, look, we've got about 5 minutes to go. Would anybody else like to make a comment at all? There's quite a few of you still on the call. Would anybody like to add their own experience of this or thoughts on this? You would be very, very welcome.
Just to say, John, if there is any future work, if you want to, you know, if you're going to move this agenda forward under the Institute, I'd be really interested in supporting you to do that. Well,
thank you very much. So, I mean, absolutely we are. Mm-hmm. I think one of the things that just, and I'm sorry to bring it up again, but it keeps springing out. How are we performance managing people? Mm. And does that make them feel motivated, or does it make them feel put upon and under extreme stress? And I do think that's something that we need to have a look at. We cover it in our high performance leadership modules, and we have a different view perhaps to what has been the prevailing approach over the years. But I think that comes out of this to me as a huge area that we need improvement upon, and somehow, I mean, I know that's system led, because we are obliged as health and social care people to be part of a system that expects certain things of us, that are targeted and measured, and it's out there for the public to see. But a lot of people in our organizations have very little control over what those outcomes might be. And I think we'd be much better much better as an organisation, where we're leading small teams, relatively speaking, within our social care organisations. I think as leaders, we would be much better advised to forget about these big ticket targets and instead concentrate on how we're making our people feel through the way that we lead them.
I think that's really, really important, John. It's probably one of the most important things that we can do for staff in the system now, across both health and social care, who are feeling battered for lots of reasons.
Yeah.
So I think it's really important. Well,
I think it's if we agree that it's within our gift to do something about that, then let's get on and do it. You know?
Absolutely.
All right, folks. Well, I think that's been a good old romp through, hasn't it? Quantified effects of well-being. We've got all sorts of other major stuff going on at the moment, and we're looking forward to sharing all of that with you very shortly. One important development that we're working on right now that will develop in September and be launched in September is we are developing a high-performance leadership framework so that every member of the Institute, yes, including you, will have your own high-performance leadership account within the Institute, where when you attend stuff like this, you will get points towards development of the fulfillment of your account, so that you get certificates of varying degrees and recognition of the fact that you've kind of contributed and absorbed some stuff. So do watch out for that coming along, because that's all in the business of continuous improvement for you as an individual and helping you develop self-confidence and self-empowerment around leadership. So do keep a lookout for that. We'll keep you updated. But for today, that's pretty much bang on the money. Thank you, everybody, for coming along
John.
today. Really appreciate it. And we look forward to seeing you on the next one of our Power Hour events. Thanks so much for contributing and for stopping.
Thank you, everybody. Thanks, John. Thank you. Bye-bye.
Bye.